Hey, everybody. We'll just get started in a second here while folks roll in. So, welcome. We're chatting technology in the social sector specific to case management today. So, hopefully, you're in the right room. Yeah, welcome. And if you want to say hello in the chat, who you are, what organization you're from, community, and First Nations or Métis region or Inuit region too, if you're joining us from the north. I would love to say hello. So you can just try the chat and we'll go from there. And yes, of course, we will be recording and providing you the deck and a couple tools as well that we're going to be showing today so that you have something to walk away with. Yeah, it'll be on YouTube as well, posted on YouTube in case you have some needs for late night watching of software and tech and data content. But yeah, hi Nicolette, thanks for the question. Yeah, if other folks want to say hello while everybody rolls in, I'll do my best to do some shout outs. And yeah, in the meantime, I'll introduce myself. So Alina Turner, and I'm one of the co-founders here at Help Seeker, and we're a team of folks that come from the social sector or the tech sector, but we specifically focus on the social safety net. So anything to do with mental health, addictions, even developmental disabilities or homelessness services, housing, and of course the key population, so Indigenous, First Nations communities, we do quite a bit of work in. And of course, in the major urban centers, immigration and refugee work as well. So it depends what your focus area is. Hopefully, there's going to be something here for everybody as well. But if you have specific use cases or kind of wondering about how this applies to your domain area, by all means, let us know. So I'm going to do a couple of shout outs while people settle in. So Veronica from North Vancouver, Holly Byrne Community Services, Family Homelessness, caseworker, wonderful. There you go. Lower Mainland, again, Big Sisters of BC, wonderful. And also putting in some of the First Nations place names as well. Love that. Fireflies as well to record and take notes. Oh, that's your bot. Hi, Sandy. Hi, Sandy's bot. There you go. I guess we don't want to do shout outs to AI, but we are talking tech, so that's okay. Yvonne, research manager at Thunderbird Partnership Foundation. Wonderful. And nice to have you here as well. I have a background in research and policy, so that's I'm sure we have a billion things to talk about and how data can inform your efforts there. Okay, our collective journey, Medicine Hat, Jim from Suki Family Resources, and Tuki Territories. Awesome, awesome. Keep them coming because it's also about you all getting to know each other as well and understanding who else is thinking about technology and data in a more modernized way. And we'll keep an eye on the chat too throughout the webinar if there's things we can answer on the fly as well. So I will get started, and I'll begin by acknowledging our traditional territories where I'm joining you from. So that's Treaty 7 and Mohkinstsis, which is Calgary, known today as Calgary. And again, encouraging everybody to can acknowledge all the territories, but just to see the diversity of where folks are coming from. And it's September, and Truth and Reconciliation Day is around the corner. So hopefully you all have some exciting and important work that in terms of reflection that you're thinking about as well. And we, again, will do our best to integrate some of that insight throughout today, even though we're talking data and we're talking technology that always, there's no reason why TRC efforts are not part of every conversation when it comes to the social sector in Canada. Well, hopefully not just Canada, but we'll worry about the other neighbors in a different content. Okay, so I'll begin my slideshow, and just again, if hopefully you're here for in the right room. We have had challenges on from what we've seen in other in some funny memes. So we always just begin with that. We've never personally experienced, Zoom bombing, but there you go. So a little bit about what we're going to be chatting about. I'm going to give you a quick who we are, just so you know where we fit into the landscape at Help Seeker. Go through the challenge and why we're taking this big technology lift on in the nonprofit sector. Solution, and it's part of a bigger modernization technology, being an aid in your efforts to further your mission as well. We'll do a demo, and Travis is here. He might have met some of you guys in the past. He'll, I'm sure, introduce himself when he comes up, but he does the demos much more succinctly than I do. I get distracted by all the bells and whistles, and I said, you know what? Let's get a guy who's on task. And then we'll of course have some time for Q&A as well. So we'll get going on a bit about us. Never thought being proudly Canadian is going to be so meaningful, but there you go. So Canadian Social Innovation and Technology Company. We're a B Corp, which means we're a social enterprise through and through. We do good by doing good, which means we work exclusively in the social sector, and our deep expertise around data collection, analysis, and really that social safety net transformation through data and technology. But systems planning, social impact is kind of our raison d'etre, which means none of this stuff should be just done for technology's sake. It should be driving that bigger systems change that we all want to see, because we all think we can all do better, and the sector can do better, and the systems for sure can do better as well. We primarily work in government, community, so on the ground nonprofit organizations, but also, like I said, municipal governments, provincial governments, and federal government, as well as Indigenous government, as I mentioned. So we'll get into the problem, if you will, and I'm sure this is probably why you're here. You're experiencing data that's scattered in different databases, probably, so siloed databases. So let's say a funder required you to use X, but it's not quite meeting your day-to-day needs, and you're finding yourself that you've still got paper files. They might be Google Forms and Google Sheets or Excel spreadsheets, etc. But for a number of reasons, which are structural and systemic, let's be honest, the way that our data has been managed has been sometimes, well, not sometimes, but often top down, and in that sense has created some chaos when it comes to day-to-day management. And then, of course, different teams. So depending on funding stream and depending on the kind of the priority of the day, teams end up tracking data very differently in the same organization, and there isn't necessarily a single source of truth. So if somebody said, okay, but for real, how many clients did we serve last year, and how many of them went through which program, and what outcomes did we have, and who did what part of that outcomes attribution, it becomes really difficult to answer that with a single source of truth. And you should have it, right? You should have it at your fingertips. So that manual data entry, that duplicated effort and frequent errors becomes a real challenge when you try to make the business case for continuing a program or refining a program, ending a program. All of these things have lifespans and need that renewal, and the information should be at your fingertips, should be timely without hours and hours trying to pull it all together. So that's the data chaos challenge that we're talking about. And we talk about it not just for making the case that it should all be in one place, but we're making the case for it because all of that wasted time means there's less time delivering programs. So you often have caseworkers that are spending quite a bit of time trying to move data between spreadsheets and reports and funder requirements and leadership requirements. That inaccurate and inconsistent data can really lead to very shaky decisions, and we see it all the time in our work, where the organization might believe that they're serving a certain amount of people, but because the data was so diffuse, Sometimes it's way more clients than they thought. Sometimes it's way less clients than they thought. And certainly when it comes to anything like, what percent might self-identify with a specific gender, or what nation a client might be from, et cetera, or country of origin, et cetera, that inconsistency, right, the way that data gets recorded can lead to some, misunderstandings and potentially some bad practice because you're making decisions on bad data. So all this contributes to the usual in our sector. So staff burnout, frustration, and of course the inability to be innovative because you're constantly just trying to stay on top of that data chaos, information and insight chaos too. When it comes to measuring outcomes and demonstrating that impact to yourself, right? You're in the day-to-day grunt of this, your organization, your program, but of course your funders, because that's who ultimately enables us to do this work, and we need to kind of prove that value to society via the funder relationship. It becomes shaky, right? And so that's the implication. So the kind of flip side on this, and where we're seeing success on this aspect, is to rethink how we use technology in case management, and rethink how some of these new methods of collecting data can start to solve some of these challenges as well. So our big idea, was to have all the program data in one secure cloud-based system. And the idea here was that rather than forcing every program to conform to one template, that we would actually have the technology to customize each program so that everybody collected the things that they needed to at that programmatic level. And those things, I know for sure, they change, and they sometimes change on a dime, but still enable all that data to come into one kind of centralized data center, nervous system, and give us those insights at a holistic level. So the idea is staff can log in from anywhere and update those records, and the staff are able to create things like automatic reminders and digital forms to replace paperwork and that memory juggling. So some low-hanging fruit of technology. And then importantly, dashboards to show those up-to-date outcomes at the program level and then at the organizational level. That being the idea of saving the time, but also coming back to the burnout. If you don't understand what impact you're having, it makes it really tough to get up on a day-to-day basis and do this work as well. So key benefit that we are positioning this for is one system. You enter the data once, but you reuse this same data for different purposes, because you can now pull that data in different reports. You can pull that data to understand client journeys across programs in the same organization while maintaining, importantly, privacy. And we're going to get to that in a second. We're able to then create that task automation. So things that you forget, or things that you'd like to be more proactive about, getting tech to help us there. And we all love our calendar notifications, and we all love our kind of task automation. So how much of that can we take off the day-to-day workload of folks to make sure that they are focusing on the client delivery rather than the data entry? So the idea as well is that when staff trust the data, because there's less duplication, so you now know that Bobby here is the same as Bobby there, then you're now able to actually have a different way of working with the client, and different way of also distributing caseloads as well, and understanding of course the bigger impact, because you trust the data. So, and hopefully this all leads to team members feeling more supported. They've got that morale boost, and the tools are helping them rather than being something that they have to do. Outcome tracking and impact reporting is something I want to spend 2 seconds on here as well, because again, the whole concept here is that we're able to track the client from the first touch point with the organization, whether that's reception, whether that's a research project that might be undertaken, whether it's an outreach session or a street outreach interaction. So that initial intake with that person's record carries through the entire lifespan of that client's interaction with the organization. Of course, like I said, I'm going to get to privacy in a second, because that's you can't talk about any of this stuff without having all of that figured out. But can we take that data that's being collected and turn it into those insights? So what trends do we see in client journeys? Are certain clients doing better in certain interventions or combination of interventions? What are their success rates depending on the need that they presented with, right? So, and then that opens up a whole opportunity in terms of data science for you, because data science and AI and all those great tools that everybody's talking about, those rely on good data. If you don't got good data, you're going to get really poor outcomes, if any, or you might even get dangerous outcomes as well out of those tools, artificial intelligence tools, for instance, or data science tools. Imagine doing a correlation analysis, but all of the data assumed there's 400 clients, but actually there was only 100. So is that correlation analysis worth anything? No, it's not. So this is about getting the right data so that you can actually say something true about outcomes. So data-driven decisions, you want to be able to adjust those programs based on what's working and what's not. And you don't want to have to pay a big consulting contract, $100,000, just to get the data out and make some sense of it every 5 years. Like, you should be able to just open up your dashboard and take a look at what's going on in the organization. That should just be part of what the software does for you. So now, what does it cost you when you don't have this, and what does it cost you when you do have it? So I thought I'd stick to when you have a modern case management tool, and I'm not telling you need to go with ours, but when you have something like this in place, your benefits are quite significant, because essentially it pays for itself. You've got the annual benefits that accrue because, again, your savings are coming from staff time, so there's more staff time. You're doing it because you're not having to hire and contract out evaluation or research tasks, i.e. your research team can take this on in-house, and we see that with some of our clients as well that use this. They can leverage this data with client permission for major research contributions because the data is ready to rock. They don't have to then collect it again. It's ready for mining. It's ready for that analysis as well. So there's cost savings there as well. And then those automation of tasks are low-hanging fruit. Every staff member who needs a reminder that they don't have to do manually can now, again, accrue those benefits as well. So something that costs $10,000 to implement, right? The software implementation, has an estimated return just in an annual basis of 6 times that, but the ROI, the return on investment, grows over time, right? Because your team's getting used to it. It's got these knock-on effects, positive knock-on effects year after year. So I'll show you 1 second of what this can look like, and said I'm going to share this with everybody. And again, you can change up the inputs. So things like the average salary of the staff, we worked off of 70K, how many users you might have, hours saved per week. And again, you can use this one as a baseline, but you can, of course, do your own numbers, and essentially just shows you the results. So the annual benefits and the annual costs. So the cost is 10 grand, but the benefits are 57. And then you can look at that over time. So I said we'd share this, but feel free to use it in your decision making. Like I said, there's lots of vendors out there that are great. Obviously, I think ours is the best, but I know that you've got lots of choices. So appreciate you doing your comparative shopping as well. So the consideration that I think is really core here around key benefits and compliance and data trust is that no matter what you go with, and for us as well, needing to have that Canadian data residency is just a given. Like if they don't even bother. So yeah, ours is of course stored on Canadian soil. to meet those funder and legal expectations. And every province and territory has a bit of a different vibe on this requirement, but the consistency is there that you can just safely assume that. And nowadays, right, with our trade war, it's pretty clear that Canadian technology, Canadian intellectual property, Canadian data should be repatriated where possible, as much as possible, right? So multinational corps that are headquartered who knows where, you just don't have the same level of control, and you don't have the same legal recourse if anything goes offside. And of course, if you're getting funded by a provincial, federal, municipal governments, then it's oftentimes just simply a legal requirement or a funding requirement. So PIPEDA, this is federal legislation that we're all compliant or have to be compliant to around data privacy. So things like collecting proper consent, things like encryption, access controls, i.e. a program manager should see a certain level of information versus a case manager within the same program, but then how do programs share information across each other, and then what does the CEO or executive director get to see? So those are called role-based access controls, or access controls, just as a shorthand. And it really matters, right? Some organizations have as many as 30 different roles because there's so many rules between programs. So your software should be able to accommodate for that without compromising your executive level strategic insights to say, yeah, as a whole, we have had this many clients, and as a whole, here's the trends. But do you need to be able to drill down all the way to, again, to Bob? Maybe, right? Depends on the role, depends on the use case. And in some organizations that are tiny, the executive leader, it does case management, does data entry, and board presentations and media. So in that case, absolutely appropriate. In bigger organizations, it gets a little bit more complex, and the software should just be part of the package there. I'm going to make an important note around Indigenous data sovereignty, and I'm going to reference OCAP principles, but I will say that Métis, as well as Inuit organizations and nonprofits or governments have their own principles as well. But for us, we're OCAP certified in terms of our staff working on this data. Software, as far as I know, does not get OCAP certified, but people working on it do. And this is really about the concept of ownership, control, access, and possession. So the ability for the data to be in the possession and control of the First Nation is absolutely the kind of core principle behind, it's your data. And I would say this is across the board. It's not ours. We're really here as the software vendor that's hosting the technology, but the data is your data, and you have the ability to take it out anytime, right? And I've seen a million examples of where this is not practiced, not just Indigenous context, but actually any context where you put the data in and then you got to pay to get your data out. So your data is kind of captive, if you will. So that's not the case, right? You can just Excel download your data anytime. And you should be able to, because portability of this data is core to, again, control, ownership, access, possession, right? You shouldn't have to go jump through hoops there. So communities control their information is absolutely essential. And that's really core to how we develop this as well. And then, like I said, around strong security and privacy practices, I mentioned a little bit about privacy policies. So making sure that whatever you have in place is reflected in the software. And some really great resources here too. If you want to hear more about security and privacy practices, I mean, we could do a whole webinar on that. But Social Work Portal is a really great resource. And then FNIGC is the First Nations Governance Council is another really, really good resource if you want to hear more. And highly encourage you to get certified if you're not and working in this space. So with that being said, I'm gonna just let Travis actually walk you through just so you get a feel for what this case management looks like in practice, and then we'll come back and do some Q&As. Thanks, and I'll do some chat responses as well while he sets up there.
Hi everyone, I'm Travis Turner. I'm the other co-founder here at Help Seeker. I do a lot of the demos, so if you ever book a meeting to check things out, I'm typically the one doing them. So I'm excited to show you guys the product. I'll keep it fairly high level, but if you do decide this is of interest, I'm more than happy to book some time and go a little bit deeper on it. As I'm taking you through it, think about how this would apply to your specific situation. I did take a look at the list of folks that are here, and I know there's quite a range, anywhere from, a homelessness shelter to folks that are working at a national level, working with communities, doing outcome-based stuff. So keep in mind that everything I'm showing you is 100% customizable, all the way from that data model, starting point on what data are you collecting, to the colors of that are on the screen and the graphs. So I will share my screen now. Okay, so this, of course, is all demo data, but it was built off of an actual implementation that we're doing right now. This is my super admin. So you're going to see extra stuff on the screen. Possibly it's a little busy, but what I want to show you with this one is really here. And this is so important. Back to, if you have 20 different programs in your organization and they're doing all these different things, do you need 20 different case management software? And unfortunately, we do see that where they have a whole bunch of different software. So with this one, you can even just see the diversity in the types of programs here, right? And so this covers, you see it covers so much. And then this is the home page here. So with the home page, back to the roll up of that is how many clients do we actually have? So you can see big data, of course, but 606 people in the system. How many referrals were made? How many open cases? So what are those key metrics that you want to see as an organization to be able to have those conversations, to show what you're doing? We can have those displayed. How many units are available? So there's always questions on, well, would we be able to actually track live what's available in the system? Of course, right? It just requires that you're putting the data into there and then we're displaying it in a useful way. Calendars. So what's happening right now? What did we do last month? So going into the system, we can also visualize it that way. Caseload, cases by program. So we want to know actually what the breakdown is, so we can have that breakdown of those pieces here. Like I said, all of these pieces are customizable. I'm going to jump down into residential just to show you that here was the motherboard, if you will, but now you jump down into a program level. I'm also going to show you what it looks like actually for outside of my super admin here. But this was built strictly for this organization, for their specific needs around cycles, and the specific outcomes they wanted to track within there, follow-ups, attendance. So there's those. I'm going to show you child and family services. So with this one, they just wanted to get straight to the point. They wanted to know, okay, what's in the or who's in the system. So they wanted to have that quick access there. They didn't want any sort of calendars or anything. It was more like a database type product. So I'm going to click on here, going, okay, here's the different pieces. So you'll see there is a ton of different data spots here. And that's again because they wanted this, right? And then there's we needed this to be able to go across all the different programs, but not everybody's going to see this in the system. This is, again, is my super admin, so I'm able to see extra pieces in here. But you can see the diversity in it, from language to demographics to employment, legal situations, and all of those can we can have those as drop downs. They can be free text, whatever that is that makes the most sense for that. It's custom built for you folks. You can see user access. Like Alina said, user access, security, privacy, all of those is a webinar in its own. So I'm not even going to touch that. But with the system, it's customized to those your specific needs. So a manager looks different than a caseworker, which looks like different than a director. Whatever those different elements are, we just build it out for that situation. Outreach, same, yet of course different. If you notice along the top, new person, create case, those key data elements go across the system. I already showed you person. Now I'm going to show you what a case looks like. So here's the case. So you need the name of the case, also what program, who it belongs to, the different elements. I'm going to do one for events as well. So create an event. This is an interesting one. So high level, we have person, then we have case, or we have an event. Within an event, there's so many different things. So each one of these has its own full set of drop downs. So we go, it could just be a case note. It could be group sessions. People ask about attendance. Could I run a class and do attendance? Yeah, we have that built out. Shift logs, bed log. So this is back to that occupancy piece, is how many beds do we have available? There's those pieces. Clicked on something that didn't like an automation. But that also, the automations, another question I often get is, well, can we automate that? And in general, yes. So when somebody enters X into the system, I want to be flagged. Absolutely. So what we could do, so I'm going to go back to this home one, is here you can see, I just have this as a placeholder, but there was a critical incident yesterday, please refer to blah. So what we can do is actually have it when somebody logs a critical incident, it emails everybody in the system, please refer to blah, 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 blah. So those automations, they're built specifically for your program, for the organization. Research and reporting. So this one, again, if it's going into the system, we can visualize it. Is it going to be fancy projections and, 5 different data sets that are layered? No, but it gives you that instant right here. I need to know this sort of thing. And then they can actually all be downloaded as well. So you can see save this image, we have the data. So that quick snapshot within the system is built right into here. I'm going to also hit this. So we have this as research and reporting, survey form. So you can see this is actually from one of the clients we're working with. But what they wanted to do is they actually wanted it to have their surveys that were going out come into the same spot. So they go, okay, I need more details here on this specific situation. And so they send the surveys out. But then also, how does that compare to the overall, demographics or into this? And so they can actually have it all sitting in one spot. So instead of doing SurveyMonkey, which is then stored down in the US, and then they have to export it and import it, it all just resides right in here. So we do have a built-in survey tool. So again, part of the package. This one, some folks have liked this. This is actually from another one of our products. It's just built off of Tableau. But thinking about, okay, well, I have client level data. I know this. Well, how does this rank, or how does this compare to what we're seeing in Ottawa overall? And so there's a whole bunch of cool features within here. So you can see within here, spatial analysis, we have something built with it. And it's all just based on, it says 2021, but it's, I think there's some historical in there from the years before too. But you can start to understand what different neighborhoods, what's the population build of it. So we know that there's more seniors in this area versus young people in this area. So again, as you're starting to do your research or you're looking for money through grants, often they're asking some of the really basic stuff like how many youth are in the area. And if you can't answer that, then it's sometimes really tough to apply for those sorts of things. So that's mine. You can see all the different programs into one. I'm going to quickly transfer over. So I'm going to log myself out. I'm going to log myself in to a manager account and just kind of give you a quick. So now you're going to see essentially the same thing, but here's what a manager then would see. So same part, they're going to be able to see all their clients. And then if we went same thing down to a caseworker, then it'd look very similar, but they're only going to see, say, there's 6 clients that they're working with. So you're not going to have all this extra stuff. And if we wanted to even do this, then it's even cleaner. People ask about, is it mobile? Do you guys have an app? No, we don't have an app for it. There's all sorts of security challenges with that, but it is mobile friendly. And if we know that that's kind of like your main thing is that you guys will be, using it for outreach, you're going to be on iPads, then we make sure that it's dialed in for that specific use case and going, okay, we don't want to have all this extra information in here. We just need these really key things for mobile. So that's that one. And last but not least, because I want to show you the diversity of the system, I'm going to show you something completely different. Same thing, another demo board. Where we go, okay, here's demo board. Looks a little different. I want to add a new community member. Okay, so here's what it would look like here. So you can see again, not quite as busy. We're keeping it pretty simple with this one. So it can be as complex as you need it to be, or it can be same thing, as simplified as you want it to be. Just going to show you one last thing. And I want to make sure that we do have enough time for. Yeah, so here's again a list of folks that are in the system. Of course, all fake data. We can then start to go by inactive. We can sort them however you want to. You can prioritize. We can help with those sorts of things. You can see by names list is in here for any of those that folks that are working in the homelessness sector. We can support that too. And I could talk about this all day long, but I'm not going to. And I'm going to pause and turn it back over to Alina.
Awesome.
There's a few.
Well, we might keep you on the hot seat, Trav, because we have a couple of questions. So first one is, I'll go kind of backwards here. So how much control do administrators within organizations have versus the software vendor, versus help seeker in this case?
Good question. And I'm going to give you a bad answer. It really depends on that situation. Is if somebody's really comfortable with technology and building and they've been an admin for this space, we can give you high levels of control over it. We've also had that situation where folks really want that high level of control over it, but they don't know how to do it. So then do we really want to do that? Maybe. Could we provide you training? So the ability 100% is there to give you high levels of control. But is it always the best situation?
And I think just to clarify maybe the intent from the question, is the question essentially though, Like, is there a power over in a sense, or might you explain that? Because I think we need to distinguish like the software vendor, we're the kind of the hosts of the data, but
Yeah.
it's your data, and if you wanted to have all this control, you could have it, and we have to abide by our legal obligations too. So there's things, for instance, we can't see client data unless you give us permission to do that, right? Or we can't just go into your system and browse around client data. We can, but if you need, let's say, and this happens all the time in implementation, staff mess something up or they don't know how to do something. So then they'll ask us for support. In those cases, the tech provider comes in as a contractor, and that's the legal kind of mechanism for us to be able to help your staff on technical troubleshooting, let's say. So it's that type of relationship. And now back to Travis's point, how you guys want to kind of create those powers and what can the executive see versus the case manager. That's really, I have found that there isn't like,
Yeah,
oh,
who can make a survey, who can't, who can make a charge, who can't, who can delegate out what role in the system. Yeah.
it
So
depends. It depends on, and it's program by program, I find too. And I'm actually going to use this as a jump off for the second question here because it goes really nicely. Is user access customized to each client file? And we have had instances where that is absolutely appropriate, right? So only certain, actually even deeper than that, only certain people can see only certain parts of that case file, the client file. So the same client could be served by different programs, but the domestic violence program gets to see this component with client permission, and another organization can only see this much. Where you get into challenges operationally, it's not a software problem, it's a policy problem for the program, is if there's an actual kind of security challenge with that. So for instance, this program is servicing a person with a domestic violence background, and then this program is servicing their spouse. And this client doesn't want to tell this program about their violence background, but then shows up in the program's day drop in or something like that, and now is exposing their ex, for instance, to security challenges or their children. And so in that context, that's really your guys's subject matter expertise, and you have your codes of conduct and things like that. So in certain instances, what programs will do is they'll actually create a notification, like a flag. So you're telling the clients like, hey, and this is how we practice. It has to be a safe space, blah, 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 blah. We're not going to just reveal your entire record, but we do need to, if you do pose a threat and it's part of your custodial agreement, et cetera, we do have to put that into place. And then in that instance, the technology should be able to support that as well. So it's a roundabout way to say, yeah, we can customize it to the client file. But as you implement these things, all of this stuff comes out as well. So if you haven't looked at your policies for a long time and you're looking at upgrading your tech, it's a good time to also, it'll bring up all these questions for sure in your day-to-day practice, which is a good thing, I think. And it looks like, Trav, did you want to add anything to that?
No, there was a, excuse me, follow-up is, can administrators themselves do that? Yes. Again, the possibilities there. Do you want to do that? Should you be doing that? Do we need to train you for it? Yeah. But is it possible? Tech-wise, yes. Our system is for it. Cool.
Ideally, you're self-sufficient, but we keep the training wheels on until you're ready. We have found just to be successful. And you should actually maybe mention something about the customer success, because it's not just giving you a bunch of software and letting you go with it or figuring it out yourself. We have an implementation team and we have a customer success team to kind of help you troubleshoot and grow. And they'll grow the software too, because as you get data, what do you do with this data, right? What does it mean in terms of your practice as well?
Good. Next question.
Yeah. We've got how does this interact with other case management and health databases, for instance, referrals?
Go for it, Marina.
Oh, yeah. So two ways. If other software, if you're part of a system of care, for instance, that has already mobilized around a referral software, referral management software, for instance, and that software has API capability, so the ability to kind of speak across or software, ours does too. So there's a way to integrate them, and if that's part of your use case, then let us know. If you're looking for a referral management software and you need to have a way of managing that, we'll have a whole webinar about that as well, because we
And in
definitely have seen
general,
that.
other integrations, we just need to understand what you're wanting to integrate with, why you're wanting to integrate, what data you're looking to share. Is it one way or is it two ways? But as far as technology goes, yes.
Mhm.
Yeah. Good.
Let's see. Servers located for the cloud-based software. Oh, Ontario. Majd.
And it's through Microsoft. So Microsoft in Ontario.
Yeah.
It's where it's held, cloud-based software. Yep.
Yeah.
For servers.
Okay.
What above it?
Yeah, what about service forms and data selection on the forms? Can agency design service forms to be used, or your database has templates agency needs to choose from? No, everything you saw, I was actually going to get you to click on a couple of those drop downs, Travis, because yeah, the implementation is actually really interesting because you actually have to create a data model to make sure that the data comes in actually rolls up properly. So a really easy example would be, let's do the oranges and apples thing, but they're both fruit, a type of fruit, so they should go in the fruit drop down, right? But we see it all the time where this program collects country of origin, and then this program collects ethnicity, and then they mash them together. Well, in the implementation, we actually have to look at what do you have to report on, what are you trying to measure, what are the common demographics across the entire organization? Can we create a taxonomy, so like essentially a glossary that actually ensures everything's lined up? So it's a bit of there is a cleanup for sure, because everybody's been doing things kind of oftentimes, I shouldn't generalize. In our experience, most people have kind of their own ways of measuring, and each funder has slightly different wording. So you actually have to create a global taxonomy for the organization that rolls up to the different funders and then rolls up at the executive level, but still allows each program to continue to operate at the level that they need to. So that is a really interesting question. And therefore, to your point, Majd, everything has to become customized as part of that implementation process. But I think like we've got it down to about a week of implementation for like a typical instance. So I don't want it to seem like this is hugely onerous. We have great tools, we have a great team. Like it's not a crazy task like it used to be, right? It used to be years of trying to collect all these forms and make sense of them. But now we've got artificial intelligence, and we've got expertise, we've got different ways of doing it, and experience. So good one.
Other questions for us?
Yeah, just scanning here. It looks good. Looks like we're good. Okay.
Perfect.
Yeah, I'm just going to kind of wrap it up here, and I'm just gonna take this home, if you will. But yeah, if you're interested and you're thinking about it, it's possible. It's never been more possible than now. It used to be such a big change, and it used to be so costly, but things are pretty good, right? I've never seen it so um, you know low barrier as it is now to start using some of this in your day-to-day. So if you want to take that next step and thinking about it, yeah, don't let the current data problem hold you back. It's an opportunity, and there's probably so much insight that's waiting for you, even in the dirty laundry, if you will, because that data migration can reveal some really interesting insights already. And as you move into the next step, it's amazing stuff to start to to look at. So call to action for all of you thinking about it. Just one concrete little step per month. So it could be, call Travis for a deeper dive, doing a data strategy chat in your teams, audit your current system, see what's in there, even figuring out, is your data even in Canada? Are we sure? Can you get your data out? What can you do with it, right? So just little things like starting to kind of inch towards change. It's always great. And yeah, if you saw any resources that you're interested in, or you want that tailored demo because you're doing some comparative shopping, we're always excited to learn about you guys, and we learn so much out of the chats we've had with everybody in the sector. So don't hesitate to reach out. You're doing us a favor because we're learning from you, and if we're a good fit, great. If not, you're still walking away with some insight and from us, because again, we can ask us questions that are, to do with data that, you might not be thinking about transitioning for years potentially, and that's okay, right? It's important to be on top of this stuff and see where the tech sector is moving as well for you.
Alina and Travis, so there's just a couple questions that came through. How familiar are you folks with IRCC contract requirements / iCare? Exploring a new alternative platform as our current system, OCMS, is not meeting our needs.
Okay. Oh, the IRCC, so this is Immigration Refugee of Canada. I'm very familiar. We have done implementations in the immigrant and refugee systems. So yeah, give us a shout and we can chat more about that. There's some really interesting things afoot in that system as well politically. So I'm sure we would have lots to chat about. But yeah, definitely familiar. And oftentimes one organization will have, an IRCC contract, but they'll also have like a family services contract from the province. But the kids are in both programs. So there's some interesting kind of permutations depending on what else you're doing in your organization. That would be cool to also explore, to look at opportunities there. Employment programming is another huge one, disabilities as well. So if anybody's in those sectors, there's some really old school software that people are starting to switch out from. And then the other one that we've done quite a bit on is domestic violence and safety victim services. That type of support is interesting as well for us. And if you know me, I have a background in homelessness and housing. So yeah, I can fill your boots on that. But Trav's definitely your go-to for demo, and Taj, whose voice you just heard as well. They know this stuff much better than I do in terms of implementation. But yeah.
And one more question. Can you
Yeah.
share a bit more detail about the use of spatial maps and that data? Is it just census data?
Yeah, great question. So we do actually have a map functionality in Moretto if let's say you're doing outreach or something like that, and you need to be able to record the coordinates of where the outreach happens. So that is in the Travis didn't demo it, but if you're interested, I'm sure he'd love to tuck your ear off about that. So you can track your interactions spatially and then be able to report on that. And then the stuff that Travis showed, that detailed map about neighborhoods and neighborhood characteristics, the only data set on that is census. So, what you can do, and this isn't in the software, it would be like a kind of a special project, is you could take your interactions and drop them on top of that map. And we could take a look at that, but that would be kind of a custom. It's not part
Merge.
of it. Yeah,
Yeah.
it's not merged in the current system. Not to say one day it won't be, but we haven't seen enough uptake of that yet to kind of merit building it in. So far, you being able to drop your dots on a map and then being able to have, okay, what's happening in this neighborhood at a systems level, at a population level, has kind of tended to be good enough. And if you've never used kind of generative AI to take screenshots of maps and say, what does this tell me? Because you don't want to hire a consultant to tell you. I encourage you to do that, because there's no identifiable data in that. I mean, I should say, as long as there's no personal data in there. Otherwise, you're getting into some other problems. But yeah, good question. Thanks. Is there any other ones, Taj? I was just
I
gonna
think
pause.
that's it.
That's it? Okay, I was just gonna say one more thing we're gonna be sharing with you guys is this, are you ready for this? And not everybody is. So a bit of an evaluation checklist, so practical tool for you as a Canadian nonprofit. And sometimes it's not the right time, and that's okay too. But sometimes it is, and you want to make sure you've got some thinking behind it. So yeah, taking a look at client intake and onboarding, case notes and documentation, and just doing that comparison between vendors. And like I said, hopefully we're one of the vendors you're going to be looking for. These are the things we would look at. So client intake, for instance, and we just have 3 vendors at a time, and you can just click them off. And again, like I said, ChatGPT, their results, which is the top one, make a briefing note for my executive director. It's pretty easy, but the things I would look for are client intake and onboarding, the case notes and documentation. Is that easy to do? Reporting and analytics. How hard do I have to work to get this data out? Can I customize it? Service planning and tasks. How good does this help me actually map my program's needs and track like the day-to-day tasks? Client communication. Can I communicate through the platform with my clients, collect intake information from them, etc.? Data export and backup. So yeah, how can I get my data out, or do I have to pay you? is usually a pretty good indicator things are not quite right. Client outcomes and goals tracking. How easy is it to do that and roll it up? And of course, customize those outcome reports for funders. Assessment tools, if you guys are using, and I'm gonna, I think you saw like a CWA, our assessment tool. Everybody has their own kind of toolkit, so you need to be able to add those in as well. And some vendors, if it's not in there, they won't build it for you. We haven't found that. Usually by building it for you, we can then open it up for other people faster too. Yeah, will people help you? Will software vendors help you with your funding reporting, right? So I'm stuck, I don't know how to get the data out, or is it like, too bad, so sad, you're on your own? Data residency, OCAP support, kind of even explaining things to you around Indigenous data sovereignty. We're not experts, but we've got some experience in this for sure. And even security standards, is another consideration. Customization, whether custom fields, like somebody asked about, workflow, role-based permissions, all of this stuff is to what extent will this meet our needs? And can we add new programs, or do we got to start all over again, right, is a big one. On the user experience and support, anyways, you can kind of get the vibe here. How easy is it? What kind of training do I get? Do I get ongoing support? Can I add new users? Or again, do I have to pay $1 billion for that? And then pricing, right? So what's the implementation setup, right? What's that initial, like, get me going? What's my annual licensing cost, right? Do I get any ongoing support as part of that? Can I get additional support? Is there any other hidden fees that I don't know about? So just asking these questions is going to be really helpful. And then, of course, you can then do your comparison across them. So hopefully this little tool is going to help you. And we have it for 3 vendors. And maybe if you have more than that, maybe just do more versions of this and roll it up. But yeah, at least it gives you a bit of a guide on if I was buying software, this is the stuff I would be looking for, and whether we're it or not. Hopefully we are, but we're not always a fit either. So it's, by all means, we want you to be successful and for it to be a great partnership between your software and provider and your organization. So that's when things go very, very well.
There's
So
just one
yeah,
last question that came in.
sure.
Is there only, or basically the question is there only the initial setup fee, and then what's the ongoing
Yeah,
cost?
Travis, maybe that's a Travis question.
Yep, there's just the initial setup, which includes training within it, and that starts at $5,000, depending. So a massive organization with 52 programs in it, and it looks a little different, of course. And then ongoing tech support. So the standard tech support is included within your licensing costs as well. Now, if you wanted to add another program down the road, or you wanted to do this, then we of course can offer advanced support. But the tech support's included in your license fees.
Oh, and you didn't describe the license fees. You just talked.
Yep, and so that's at $40 per user per month, and we do discounts for longer term contracts, so we're able to get those prices down quite significantly. So again, if interested, we can book some time. I can chat you through those pieces in a little more detail as well. Awesome. Well, that now takes us right till 11 o'clock here in Alberta, where we are. So thank you guys so much. I'll be sending out the recording of this, the documents that we showed there, probably today, if not first thing tomorrow morning. And yeah, you will then have my contact info. Thank you guys so much.
Thank you. Bye.